This week, Donald Trump suggested he was open to restricting birth control in the U.S. or allowing states to do so. Then he walked it back on Truth Social, saying that he will, quote, never advocate imposing restrictions on birth control. On the campaign trail, President Biden and former President Trump are proposing vastly different visions for reproductive rights and health care in the U.S. Our White House correspondent Laura Barone-Lopez has been covering this, and she joins me now. Good to see you, Laura.
Good to be here.
So on abortion and reproductive rights in particular, former President Trump has contradicted himself quite a lot. So what do we know about where things stand now on his views?
So, Amna, former President Donald Trump has tried to distance himself from some Republicans' proposal to implement a national federal abortion ban. Some have proposed 15 weeks, and says that he will ultimately leave it up to the states to decide how much they want to restrict this. However, he's continued to brag about being, he says, responsible for overturning Roe v. Wade. And the bottom line here, Amna, is that the broad public support for abortion access is why the former president has tiptoed or flip-flopped around this issue. But he has repeatedly said that he would allow states to restrict abortion care as much as they want to, including even tracking pregnancies.
So more broadly, what has he outlined when it comes to a health care platform if he were to win a second term?
Trump has said repeatedly that he wants to get rid of the Affordable Care Act. He has said that over the years, and he hasn't stopped that rhetoric on the campaign trail. In November of 2023, he wrote on Truth Social that he was, quote, seriously looking at alternatives. But then last month, he tried to push back on attacks from the Biden campaign that he was going to again seek to repeal the Affordable Care Act, and said that he's not running to scrap Obamacare completely, that he wants to make it better.
I'm not running to terminate the ACA, as crooked Joe Biden says all over the place. It's much too expensive now, and it's not very good. We're going to make it much better, much stronger. In other words, make the ACA much, much better.
If that sounds familiar, Amna, it's because it is, and he ran on a similar platform in 2016, and when he, along with Republicans, controlled all of government, both chambers, and they attempted to repeal the Affordable Care Act, they failed.
So there's been a blueprint of sorts for a potential second Trump term that's been laid out by a group called Project 2025. I know you've been tracking. What kind of changes are the authors of that project proposing to the healthcare system?
So Project 2025 is written by a coalition of right-wing think tanks, and the healthcare chapter specifically in that document was written by Roger Severino. He served in Trump's Health and Human Services Department when Trump was president. And the authors of that document, including Severino, say that they don't represent the campaign, but this is a manifesto for any next conservative administration. And many of the authors are Trump allies or served in Trump's administration. My producer, Shrey Poppet, and I spoke with Roger Severino, who said that Project 2025's healthcare policies are a response to what he claimed are Biden administration efforts to undermine the nuclear family.
The idea that men and women are absolutely interchangeable, that a child does not need a mother or a father, is also very harmful to our society. So the notion that the Biden administration is pushing is that not only are mothers and fathers totally interchangeable, that there's really no difference that matters between men and women at all. And when I say that biological realities matter in health and well-being, they do.
As you can hear there, Amna, Health and Human Services Department, under the proposals of Severino, would strictly establish that a family structure is between a male, a female, specifically, and that is the bedrock for Project 2025's healthcare policies. And so when we look at those proposals with that in mind, here's what some of them include. Project 2025 is proposing repealing the Medicare drug price negotiations that President Biden passed, allow federal health care providers to deny gender-affirming care for transgender people, restrict Medicaid access by adding work requirements, and eliminate the Affordable Care Act's coverage of the morning after pill, Ella. We also spoke with Caroline Saccone, who is at Accountable US, a nonprofit who's tracking these policy proposals. And she essentially said that LGBTQ people, seniors, anyone looking for more access to reproductive care should be very concerned by these proposals.
So those are broader health care proposals from Project 2025. What specifically about abortion access? Does Project 2025's proposals line up with what we've heard from former President Trump?
When we spoke with Severino, he essentially said what former President Donald Trump's line has become, which is that the votes aren't there for a national 15-week abortion ban, that there aren't 60 votes in the Senate for it. But language across the Project 2025 document makes clear that the authors believe that life begins at conception. And they specifically state that the Health and Human Services Department should return to be known as the Department of Life. And they explicitly reject the notion that abortion is health care. And so some of their abortion policy proposals include scrapping federal funding to Planned Parenthood, undoing the Biden administration rule that shields medical records related to abortion from criminal investigations. That's if a patient crosses state lines. Reversing the FDA approval of mifepristone, which is one of the 2 pills used for medical abortion, and making mailing abortion pills to patients illegal. And they would do that under the Comstock Act, OMNA, a 19th century law that bans mailing anything that could facilitate an abortion.
So Laura, make the comparison for us here. How does all this compare to what President Biden is proposing on these issues?
President Biden has focused on the campaign trail, essentially making the argument that he wants to build upon his first term. He namely wants to build upon that Inflation Reduction Act piece of legislation. And so his proposals include capping insulin costs for all Americans. Currently, it's capped at $35 for Medicare recipients, expanding Medicare drug price negotiations. Currently, Medicare is only allowed to negotiate on 10 drugs, the prices of those 10 drugs, protecting access to abortion through codifying Roe v. Wade, or expanding the Affordable Care Act. So keeping subsidies going under the Affordable Care Act that are set to expire in 2025. And this week, OMNA, President Biden's campaign came out with new ads directly targeting former President Trump's rhetoric over the years, saying that he would scrap the Affordable Care Act.
It's our White House correspondent, Laura Barone Lopez. Laura, thank you as always for your great reporting.
Thank you so much.